welcome back to Skincare Anarchy. I have a phenomenal guest today. I think we're going to learn a lot from this episode, and I'm very excited to share this episode with you and to really just kind of bring more attention to a lot of the topics that we don't know about in skin health. So without further ado, I want to introduce you guys to Dr. Amir Karam, who is a double board certified surgeon, and he is in plastics and also I believe otolaryngology, doctor.
Yeah, that's right. Yeah. So my background is in otolaryngology and facial plastic surgery, but primarily my practice is facial plastic surgery.
That's amazing. And also he is the founder and the genius behind his amazing skincare line, which is if it's well, the website is it's called Karam MD
That's
skin.
right. Yep.
So
Karam MD.
Karam MD
Exactly.
Skin. Yep.
Yeah.
KaramMDSkin.com. And I'm going to link that in the end. But I just wanted to introduce you guys properly to both facets of his credentials. But welcome to the show, Dr. Karam. I'm so thrilled to have you. It's such an honor. And I can't wait to dive in.
Yeah. I'm excited. I'm excited. Let's chat.
Yeah, I want to get started with really about you and your journey because I know, going the route of surgery is definitely a very hard path, and I'd love for you to give us some background on why you chose this direction for your career and just how it's been and how the skincare line came to be, all the details.
Yeah, absolutely. No, it's definitely been an evolution, and I'll kind of take you back to the origins of deciding to be a surgeon, and then much more upstream came the decision to develop a skincare line that I thought would sort of change the way people interact with skincare products, and hopefully really change the landscape in some ways. And we'll talk about that a little bit further. But basically, surgery for me became an inspired decision when my mom, right around my age of around 18 or 19, she ended up having a heart transplant. And all of her life, basically, she got diagnosed literally at my, right when I was born, she got diagnosed with a congenital heart condition. And so most of my life, I was interacting with hospitals and doctors and in and out of emergency departments and things like that. So I had a very close relationship with the hospital setting. And when when we were at the end of high school and beginning of college, her health really deteriorated to the point where there was really no option for her, medically speaking. And finally, the cardiologist sent her along to UCSD, to the heart transplant surgeons there, and for an evaluation. And they felt that she would be a good candidate, and they gave her hope by putting her on the transplant list. Now, for me, being a single child, that was like a major thing, because obviously, you as a young person, and especially as an only child, I think you're very close to your parents, and I was very close to my mom, and this opportunity that was given by these surgeons really became kind of a like, wow, what an incredibly important role this category of professionals have on human life and on families. So finally, a year later, she ended up getting her turn. I remember her very vividly going into the operating room, basically dusky and purple because of the lack of oxygen and blood flow. And she came out 4 hours later, bright and healthy in a way that I'd never seen her before. For years, I hadn't seen her look like this. So that moment, I remember sitting in the ICU waiting room, and I decided, you know what, this is what I want to do for my career. I want to basically help people. I want to give people, the opportunity to have the same, renewed, life, or quality of life, or chance at life, etc. And so I made my commitment to become a heart surgeon at that time. And that carried me, I was at UCSD at the time, and that basically became a 4-year, highly dedicated, sort of life that I was living, working with the same heart transplant surgeons that took care of my mom, doing tons of research and in the labs, and I just was obsessed. And it wasn't until I graduated from college and went to medical school the first year, and I remember, I'll never forget, the cardiac surgeons told me, hey, you know what? The field is changing. It's not what it used to be. You might want to consider some other type of surgical specialty because heart surgery is being taken over by cardiologists.
Yeah.
And I remember how disappointed I was hearing that. And, but it did leave a little bit of a point in my head where I kind of opened my eyes a little bit more. And and I remember in medical school, the first class we take is anatomy. And it was at the end of the year and they were doing the head and neck section on anatomy when a facial plastic surgeon who had just finished up their fellowship came and did a talk on the subject of facial plastic surgery as it relates to the head and neck anatomy that we were studying as medical students. And I just remember sitting in the back of the class and my jaw dropped at how unbelievably complex and how much diversity there was in the field of facial plastic surgery, from from trauma to reconstruction to cancer to cosmetics to rhinoplasty. I mean, it was just an incredibly broad and very technically difficult field, but also very creative. And all of those things really triggered my interest, because I always knew I had this kind of creative side to me that I knew that wasn't going to be expressed in cardiac surgery. And
Yeah.
so anyhow, so I got interested in facial plastics, and I started learning more about it. And next thing I knew, 11 years later, I fell deeper and deeper and deeper in love with it from that moment forward. And then and I finally got to become a facial plastic surgeon 11 years downstream.
Well,
So
what do you mean got to? You worked your butt off for
yeah.
it.
No, it was definitely I think a huge advantage for me to decide that early and start getting really focused on it, because the sooner you start accumulating ideas and weighing the different things, it gives you a lot of independence in terms of the way you think. Unlike, I think, some people who decide very late in the game and then they just go into a fellowship and spend a year or two and basically they're just downloading everything that the mentor tells them. I had the opportunity to kind of learn from tons and tons of different mentors along that 11-year path that gave me a lot of opportunity to be independent in the way I think about how the fields should be done and surgeries should be done, et cetera. So I was able to kind of do some innovative things right out of the gates that really set me up nicely in terms of my career path.
Of that. And I'm actually going to ask you a question because this is something I've never addressed on the podcast before, but I think it's very important for consumers to understand this. Um, Actually, surgical programs, in terms of residency for everyone listening, they look very highly towards candidates who have published peer-reviewed journal articles. So most of the time when I'm talking to plastic surgeons or surgeons in general, they have this heavy hand in the research side of things as well. That's why, like, whenever I see a skincare line by a surgeon, I'm more inclined, you know what I mean, to be
Yeah,
like,
yeah.
okay, here we go. You know
No,
what I mean? Because
yeah,
you've
yeah,
done
yeah,
the research. You really
yeah,
do have that. So that's one thing I want to ask you about, and how that journey has been for you throughout the medical, academia side of it, because, I know it's a lot to balance.
yeah.
But I want to hear your perspective.
Well, no, you're absolutely right, and I kind of glossed over that just because it was just to me almost like a given. But I, very early from the moment I decided I wanted to be a surgeon, back when I was 18 or so, I very very strongly decided I was going to go into academic medicine. And I was going to be just like the surgeon who operated on my mom, who's a professor at a teaching hospital and that type of thing. So I really groomed from that moment. I mean, I was involved in 3 different research labs as an undergraduate, clinical and surgical and bench science, and that is again. I mean, that was like 4 years of that at UCSD. Published papers, gave talks, etc., even as an undergraduate. And then when I got to UC Irvine, where I did my medical school, right away I joined a facial plastic surgery lab that was doing laser research, and at the Beckman Laser Institute. And basically, I spent the next 11 years, very, very involved, constantly, researching, writing papers, publishing, and giving talks all over the country and the world.
Well,
Um,
you're mastering your craft. You're mastering
yeah,
science.
no. Science
No.
is, I mean, yeah, no, absolutely. I think the critical thinking that goes along with the research process and the academic process, I think it really sets the tone for a lot. And for me, it was like, again, I anticipated becoming a professor. So, I mean, it was, for me, it was just jumpstarting my academic career by doing that. I had a lot of great opportunities to publish really nice papers and all that stuff. So that became, that was a staple of my journey, that I was balancing between, doing these type of research endeavors and learning surgery and learning medical science and all that stuff all at the same time. But I wouldn't have it any other way. I mean, it really, I think, again, kind of set things up for what came down there. And my current practice and what I do in private practice today has very much kind of an academic approach to things because of that background and training.
Love that. I really, you don't know, this is music to my ears to hear this, because I mean, I've expressed it many times on the podcast that I am a huge, supporter of MDs that hold on to the side of true bench research, true medical research, whether it's clinical trials or the bench, whichever, but as long as it's really looking at a problem and
Yeah,
genuinely coming up with solution. I have so much respect, obviously, but also this, in my eyes as a consumer, I expect that from a
yeah,
truly notable doctor. So I really
yeah,
love what you said, and I love that you have had this background and this amazing, just kind of take on science and the way that you're looking at it. So, my next question is obviously going to be, so what, when you first started, obviously the clinical side of things, I'm sure that was, overwhelmingly busy. So, like, what were some of the things that were hallmarks on your path to, like, creating your practice and eventually your skincare line? What were some of the
yeah.
hallmark moments?
Well,
Yeah.
so as I said, my that little bit of a jump start that I had by discovering facial plastics early gave me some interesting opportunities to really think through some problems. And one of the problems, you got to remember, we're talking about 1997-ish, is when kind of this journey started for me. And back then, facial plastic surgery, first of all, was not a very popular field, both even among students and definitely the public. And all the facelifts and different outcomes that we saw out in the real world, everyone looked stretched, they looked pulled, they looked unusual. And even when I was watching my professors at the university perform these operations, the results just looked unusual to me. I mean, it just, it's not surprising. It's just how the outcomes were. And so for me, I said, you know what, there's no way I want to do facelifts in my practice. These operations are just really unusual. They're kind of, they don't make, yeah, I mean, I don't want to say,
Okay.
yeah, they look terrible, and I don't want to be associated with that. So I really thought I was going to become a rhinoplasty and a cancer reconstructive facial plastic surgeon. Those are going to be my two subspecialties. But then something really unusual happened, just kind of serendipitously, that I was in a conference in 2004, and I was sitting in the crowd, and what happened was some lecturer was giving a talk on eye rejuvenation. I was honestly hardly listening because all the talks were always the same. They were just taking out fat and skin from the eyes, and it just every eye looked the same, and they looked hollow and gaunt and all this kind of stuff. And again, never really appealed to me. But I think I was like, as I'm scouring through what would be the next talk that I'm going to go listen to, as I'm sitting in the crowd, I look up and there's this guy showing these set of eyes that are very old looking, and then next thing I know, there's another set of eyes that are really young looking. And I really didn't even think they had anything to do with each other. But then he put them next to each other and said, this is a before and after. And how he achieved that was with fat transfer, by revolumizing the eyes. And again, 2004, this is far beyond. You got to remember, this is not even, the term volume didn't even exist. There was no fillers for volume, and we're still
Yeah,
in the
I don't think it still exists in the real general population.
Yeah, yeah, yeah. No, I agree. I agree with you. And so I remember sitting there. It was like maybe 400 people in this lecture, and it just, a light went off in my head, and I said, "Oh my God, that's what's a big part of the aging process is this volume loss piece. People are losing fat in their face." And then I started really looking everywhere, like everywhere I would be sitting in an airport, in a restaurant, whatever, and just studying and looking at faces. And I realized, yeah, indeed, that's what's happening. People are losing volume as part of aging. And so that kind of got me interested again in the facial rejuvenation. But the problem was, again, the surgical aspect of it was not great. And so as I dug in a little bit deeper, I realized that surgeons, historically, literally from the turn of the century, were lifting faces by pulling them sideways, and that was our classic SMAS facelift as a sideways pull. And what I recognized from that realization was that's not the way a face ages. A face ages from top to bottom. It goes, downward. And why are we pulling it sideways if we know it comes downward? So I started looking for other surgeons who are doing things differently than what was the 95 or 99% way of doing facelifts. And I discovered that there are a handful of surgeons starting in the mid 90s that were starting to do things in a vertical direction. And when I looked at those outcomes, they totally looked natural. So when I recognized that there was a vertically oriented lift that you could be done and a opportunity to add volume, and remember at that time it was either you're a surgeon lifting faces or occasional fat transfer people. They were trying to use fat to fill the faces and avoid surgery. I thought the real reality sort of sat in the compromise between the two, where you do a little bit of volume and in the surgery, and then you have a truly rejuvenated face. So when I finished my residency and I became a fellow in 2005, I bought myself a set of fat transfer, cannulas, and I went on. And my very first patient, which was just a few weeks after I finished, was my first fat transfer combined case. And the result from that moment on was like unbelievably natural and beautiful. And I was like, wow, this is the key. You gotta rejuvenate by adding a little volume and going vertical. And so from that point forward, I think I did like 150 facelifts during my fellowship, which was a huge number. And all of them included fat transfer, and all of them looked natural, and all of them were, and then I came out in private practice. And the reason I chose not to go academics was because all my academic colleagues were telling me that there's no way to really build a good facial plastic surgery practice in an academic setting, because there's so much service involved in dealing with those customers that you can't do that when you don't have control over the employees that you hire, et cetera. And it turned out to be a very good set of recommendations. So once I got into private practice, I started really focusing on being a facial rejuvenation surgeon and a rhinoplasty surgeon. And I did that for, from 2006, basically all the way to about 10 plus years later. And then I had kind of this moment where I was like, I had 10 years worth of outcomes to look at, and a lot of things were becoming clear to me. And one of the things that became super clear to me was that, the skin is an incredibly important part of what makes somebody look young. Because when you think about what a 30-year-old looks like, when you think about what a 20-year-old looks like, there's two commonalities that never, there's no exception to this. Number one is they have very young looking skin, right? Young by their skin is clear. There's very little blemishes in terms of sun damage. There's no fine lines and wrinkles. There's supple, there's thickness to it. And there's a brightness in general. And then their facial shape, they have, this kind of firm jawline, firm neck, a heart-shaped or V-shaped jawline. And when you put those two things together, that's what a young person looks like. So now all of a sudden I became enamored and obsessed with finding ways to make skin better at the same time as I was doing the surgery. So I was really getting involved in TCA peels, laser resurfacing, and then I would try to put all my patients on these really, really fundamentally sound skincare regimens. And basically, I recognize that number one, it's when it comes to skin, people not only have no clue what they should be doing, but also once you get them on the right stuff, it's so complicated. It's so many steps involved, so expensive, and all this.
Mhm.
The very few people are able to do the right things for their skin continuously over time. I mean, I would put them through this whole process, and then I follow up with them a few months later, and they had dropped like 3 out of 4 things just arbitrarily, or they said it was too expensive, they can't continue with it, and all this kind of stuff. And so from that moment, it became again another one of those like obsessive moments where I try to solve this particular problem by finding ways to make skincare very easy for my patients to use, so that they can use it on a regular basis. Because at the end of the day, and as well as anyone, what it takes is it takes sun protection, it takes the right products consistently over time, and then you supplement with in-office treatments and things like that for specific problems. And, but without that foundation, it's very, very difficult to get to the point of having great skin or to preserve your skin from aging. So that was kind of where my interest in skin began, and it led me to a lot of research in terms of being able to finally develop a product that was able to become fully comprehensive, very effective, very simple to use, and literally just in 1 or 2 bottles, and that's it.
I
And
love that. And
yeah,
I want to devote like a good chunk of the interview to really talking about the skincare line, but I really
yeah,
want your opinion on one big question, or
sure,
really just an observation I've had. So when we talk about, facial anatomy, right? I mean, right now in social media, as I'm sure you know, like there's so many posts out there. People are finding images, anatomical images of the face, the muscles, and just posting them up. But one thing that no one talks about is when you look at the facial structure in terms of just muscles, right? Or just like the fascia and the muscles, you are looking at a design, you could say, of, parts of your body that are like the way the fibers run is almost like a much more organized system in muscle than it is in something like skin, which is a multi-layered, not as organized in the sense that it's not like one fiber lines up with another. It's not like that. It's a very diverse environment that the skin deals with. So like it's really something I wonder about in terms of your philosophy around that when it comes to plastic surgery. And because the thing is, when you were talking about the facelift, it really it brought this up for me, because I'm like, think horizontal,
yeah,
like how does that work with the actual fibers of the muscles? Because you've
yeah,
got, I mean, if for everyone listening, you have a lot of facial muscles, FYI. Some of them, the fibers are running around, they're creating a full circle, you know what I mean? Like your eye muscle, for example, and then some are running like diagonally. So, it's a very complicated thing, right? I mean,
yeah.
I'm really dumbing it down for, I guess, myself and the listeners, but I want to get your take on that. How does plastic surgery approach this issue of skin versus muscle versus, you know what I mean?
Yeah,
That
no, no,
structure.
absolutely.
Yes.
Yeah,
Yeah.
so let me, and I actually have some good thoughts on that. I'm glad you brought that up. So
Yeah.
basically, um, again, when you're hyper focused, hyper specialized in a particular area, you start to understand the anatomy better than, like, if you're doing it occasionally. And so again, in my world, in my daily world, all I do is rejuvenate faces. And right around that time that I was telling you about, 10 years in, it became clear to me, another thing that became clear to me is that the fascia that you're describing is literally in the shape that I mentioned earlier, that young shape. That that's the fascia is responsible for the shape. The fascia is the girdle that holds the face up, and the fascia attaches up in the temporal region, attaches up into the temple, and then, in this area it's a superficial temporal fascia. Then it turns into the smaz and the deep fascia of the face down through here, which intertwines with a lot of the facial muscles that you're describing. And then it comes down into the neck. It intertwines with the platysma muscle, which then finally has its attachments to the bone of the clavicle. So this
Right.
entire
Yeah.
this entire region, I looked at it. I should say, I began to look at it as one fascial network basically, if you, again, simple terms, it's buttoned up down the center. It's attached down into the clavicles, and then it's held together here up at the bone
Well, it's
area.
like saran wrap, right? Just to give people an
Yeah,
analogy.
yeah,
Like it's the
yeah.
saran wrap over the muscles that's
Hmm.
holding everything in place in
Yep.
that structure, which is what you just said. Yeah.
Exactly. And then what happens during aging is, and this typically happens in the late 40s, again, we're being generalistic here, but somewhere in the late 40s, that fascia starts to loosen. And it starts to loosen. Instead of being this tight net that's holding everything up, it starts to loosen. And when that happens, what we start to see is a very predictable, organized direction of aging, which is the corners of the brow starts to come down, the mid face starts to come down, the nasolabial folds, as a result, get a little deeper. The jawline starts to come down, creating jowling. And then finally, the platysma muscle, which is actually intervenes and attaches into the facial fascia, once the face starts to droop down, the neck then starts to hang, and you start to see the heaviness starting to happen in the neck, the looseness in the neck. So
Yeah.
all of this is one fascia. So, and the skin is attached to the fascia. So, and as you know, skin is literally a passenger in the whole body. So, for example, in pregnancy, the platysma gets big with the baby, the skin stretches around it. Bodybuilders get big, gain weight, lose weight. It stretches and contracts according to what's happening in the deeper tissues. And in the fascia, as the fascia gets elongated, the skin gets elongated with it, and as a result becomes redundant. So the technique that I basically trademarked and developed to address this problem directly is a technique called the vertical restore. And in 2018, this I kind of made a big switch into the way I do my facial rejuvenation by doing a procedure that addresses the fascia, the temporal region, the midface, the jawline, and the neck, all in one setting. So all of it is brought up together at the fascial level by releasing those deeper ligaments. So you're not pulling against anything. Again, one of the reasons why people look stretched and pulled is because things are tethered down to bone, and when you release them, then you're able to get everything to go in the direction of those organized fibers that you're describing, kind of that same sort of vector that
Uniform, yeah, uniform fiber.
exactly, yeah,
Yeah, yeah,
exactly, bringing it all up together, and then it
yeah.
has harmony and it has balance, and everything looks like it belongs together. And that's a huge reason why my outcomes have such a natural look to them, is because it's like pieces of a puzzle coming back together. Once you reposition things back to where they were, it looks like it's where they belong. No one looks different. They don't look like they've had work done. They don't look like a different person. They just look like them minus aging, which is at the end of the day what I think people obviously want when it comes to the facial rejuvenation.
Absolutely. And I think, thank you so much. That was such an amazing explanation. And I really hope everyone caught that, because that's a huge, huge topic. It's very, it's very, intriguing to me, and I think to a lot of people, because, what you said, it really feeds into that point of what I was trying to make about the skin is like, okay, now that we've learned that the skin is attached to the fascia, and now, say we were going into the next step. So you've gone ahead and done like the work with the fascia and the deeper layers like that, and you've lifted them upwards, right? And now we have to work on skin, and you were talking about volume, right? So that's a whole different conversation, and I think it's important to kind of categorize these, like, steps that are involved in the process of quote unquote aging, because
Yeah,
that's when people will start to understand, what do skincare products really do? You know what I mean? Your
that's a
skincare
really
products
good
are,
point. Yeah.
yeah, they're not working on your fascia,
No.
they're working on the, like I said, the loose connective tissue in your skin that helps it be so pliable and flexible. So that's where I think, that's where I was really trying to go to, was this idea that there's a huge differentiation between the type of tissue you're dealing with and how you're approaching it, medically. So,
Absolutely.
that's the segue I wanted to use to kind of
Yeah.
talk to you about your line, and your
Yeah.
skincare, your viewpoints.
Well, no, I really appreciate, and then you brought up a point I'm just going to emphasize on, and that is, um, you know, it's so important for people to understand that laxity, when we talk about real laxity with the kind that misshapes the face, that's a fascia problem, right?
Yeah,
So
yeah,
that is not a topical skin care solution. It's not a laser solution. That's not, unless you physically manually move that fascia back up to where it was surgically, there's nothing that's going to deliver that type of a result. And unfortunately, when you have creams and lotions and potions with terms like, lifting, full, whatever, they're trying to imply that they're somehow going to neck, firm and lift the neck and all these different things. All you're doing is unfortunately misleading the public. And talk about something that I absolutely hate about our industry is that type of misinformation and misleading for marketing purposes, that ultimately lead to people just to waste money on things that are going to leave them disappointed, and chasing the wrong things. I've always been extremely a big advocate of transparency and honesty when it comes to this this type of work, talk about the realities of what can be done and what can't be done, and let people know in realistic ways what the expectations are. And
Yeah.
and to speak to that, I mean, specifically about skin, and we talked about our facial rejuvenation sort of triad. It's addressing the volume loss, which is fat loss, addressing the fascia repositioning, and now really addressing the actual skin. And that's a whole interesting biology in of itself, because when we're young and we think about it from an evolutionary biology point of view, there's a reason why when we get to perimenopausal age, for example, for
Yeah.
women,
Yeah.
there is a complete transition that happens into the skin. There's a massive reduction in the production of collagen, elastin, all those kind of those things that give the skin that thickness and suppleness, right? And as a result, and you also see that in patients who have had oophorectomies, at age 30 something, and they're being pushed into menopause. Their skin is on a completely different trajectory than somebody who's a normal 30-year-old with normal hormones and all this stuff. So one of the things that I think is really important to point out is, I mean, this is how I think about it, and I'm sure you have your own perspective on this, but the way I look at it in my mind is the skin. Let's say it starts off at this thick, an inch thick or whatever. Just obviously not an inch, but we're just using kind of round numbers. By the time you're in your 50s, now it's like a half an inch thick, right? So the
Okay.
question then
Yeah.
becomes, how do we keep our skin thicker over time? Because that's one of the important qualities of skin. Why does somebody who gets older need Botox as opposed to somebody younger? I mean, they're still moving their deep facial muscles, right? I mean, everyone's raising their foreheads, etc., but they have such thicker skin when you're younger. Your skin starts to thin as we age, and then all of a sudden, every one of those little motions start to leave a little line on the on the skin, and lines get deeper and deeper, and you end up with fine lines and wrinkles as you age because of the loss of organization of that collagen and thickness and production. So that's one aspect of it. The other aspect of it is, from an evolutionary biology point of view, I think the skin just sort of gives up on itself once we get to that age range, because all of a sudden it's like, maybe it's better to use that metabolic energy towards something else, as opposed to trying to keep the skin clear and try to keep the skin free of pigments and all that other stuff that again, give it a youthful context and look. So what you end
Exactly.
up seeing is those three things. I mean, those changes having thinning, fine lines and wrinkles, dullness, the epidermis becomes thicker, stratum corneum gets thicker, and then you get all these like pigments that kind of go unchecked, and you have sun damage in both reds and brown spots that start to show. So that story, if you look at it that way, is like, okay, these are our targets: pigmentation, dullness, thinning. And
Yeah.
so how are you going to address these three things in a very deliberate, thought out, scientifically oriented way, to help a person, whether they're young, to avoid that from happening, or if they're older, to gain on this sort of this direction. And so it really comes down, you got to address all three of those things. And how do you address collagen? Well, topically, you have products that can do that. You have retinols, vitamin C, certain growth factors, et cetera, that can stimulate collagen production. And then you have mechanical things: laser resurfacing, chemical peels, microneedling, all those different things that create injury, and the injury response leading to collagen production. Clarity comes down to stifling the pigments, all with whether it's hydroquinone, if it's prescription based, or non-hydroquinone type things. But you want to do something to keep those pigments from developing. And then the surface of the skin, you need to exfoliate it, you need to turn it over, you need to kind of bring that brightness and lightness back. So that was really, when I looked at all these things, I would sit down with patients and I would put them on a treatment program using all the really known and great product lines like ZO and Skinmedica, et cetera, medical based stuff. And there's a few things that became very clear to me. Number one, no one could handle, with the exception of maybe my wife and a few other patients, could handle like a multi-step program.
Yeah.
Two, very, very few people can handle retin A or retinol in its full dose. I mean, I'm talking like,
Yes. Thank you
right,
for
very
saying
few,
that. Yes.
very few people can do it. So
Yeah.
it's like, we all know, that that's good for your skin, but and with the best of intentions, you put somebody on it, and then and then you come back again, and they're like either doing it like once a week, or they're doing it like twice a week, or they stopped it altogether, and it just becomes like this non-starter. So when I went, so finally, anyways, I went through several years of being super committed to putting people on products that were available, and to no avail. No, I couldn't get anyone to do it the right way, or at least a very small portion of them. So then what happened is my inspiration, I guess, was, I said, listen, let's figure out a way that we can do this that allows everyone to at least get on the right stuff, allow them to do it consistently, let it be as least expensive as possible, as easy to use as possible, and that was it. And then so what obviously it's a chemistry problem at that point, because we already know what those ingredients are. I mean, anyone who's in the world of skin and skin science and all that stuff, all the named ingredients, we all know those things: retinols, niacinamides, and growth factors and peptides, and moisturizing, and all those kind of important things that a skin care product or skincare routine needs. It's just, how do you get these things to marry together and function well together? That's a chemist issue, right? So you obviously,
Yeah, well, I think it's more of a molecular biology issue more than anything, if you ask me, because I think it's not just about like what products can we put on the skin, what are the ingredients that we can put on the skin, but it's more so about the, the quantification of results based on dosages, which is not there right now in skin health. It's
yeah,
just not there. For example, let me just give you, my train of thought. We were talking about fascia and muscles earlier. Well, when you learn about them, there's a very easy way to quantify the, I guess the viability, or you could say, how good everything is, right? But because you can measure things like tension, which is a direct quantifiable measurement that describes a lot about any kind of pathology you're looking at, any kind of problem you're looking at. I mean, you had just talked about, sagging, right, of the
yeah,
fascia and stuff. So there's a very, I think, easier way to like quantify that kind of data on the deeper parts of our body, like muscles. But with the skin, like we talked about earlier, because these layers are so there's so many of them and they're so diverse in their composition, you have this idea of immunology coming into play, molecular genetics, you have molecular biology, obviously, cell signaling, obviously the chemistry component that you mentioned, immunology being one of the biggest ones, because let's be honest, what a lot of people hate talking about, and I'm surprised derms don't even mention this, is there's this thing called the internal milieu of your body, and each organ has its own internal milieu. And what that means is there's an environment that exists within this organ system or this tissue structure. And what that's doing, that all of those components combined are contributing to how your skin will react to what you put on it topically. Because like I said, it's that signaling cascade. And we can't quantify, it's very hard to quantify that. So, that's something I think I just wanted to put that out there, because there's a lack of understanding of true, I think, science, like, what we talked about, like from that academia standpoint, there's really a lack of understanding there, because you have to, if you have, if you're somebody who's really into skin health, you need to do the homework and look into the science, because there's nothing more transparent than the science that's published and the
yeah,
facts. You know what I mean?
yeah,
So,
absolutely.
yeah, so I just wanted to say that, but I want to actually talk about the trifecta routine that you have
Yeah,
established,
yeah.
and let's go through that, and let's talk about the ingredients and what you think is really required for good skin health.
Yeah. Well, I think that, I look at it as layers of what's required. So what I think is required in good skin health in general, it starts with sun protection, right?
Yeah.
That's one foundational piece to it. I mean, we don't have to we don't have to overthink it. You look at people who have gotten very little sun over their life because of geographically where they live. Man, their skin, even at age 70, looks remarkable. You look at Southern California generation, and like my generation, where everyone was sunbathing by the time they're in their 40s and 50s. I mean, it's a whole different skin story, right? So sun is
Yeah.
the UVA is a huge component of that. So sun protection, with using a broad spectrum, is in my opinion, it's kind of like, don't even bother with anything after that if you don't start with that. The other aspect is, and I think this is not talked about enough, is the proper diet and hydration, right? I mean,
Yes.
the foods we eat, the amount of hydration, the types of, all that. So eating, being clean, all of those things have a major impact on the quality of the skin before you even put a single ingredient on your skin, right? I mean, all that
Yeah.
stuff, stress, sleep, electrolyte, hydration, everything, right? And then once you've got like your basis covered with that type of stuff, then I think the next layer, I mean, my opinion, it really comes down to, I mean, I would say the two sort of more foundational long term. Again, we're talking about long term beneficiary type products is like retinols and vitamin C. I think those are really good for long term collagen production. You know, it's called, you know, we're talking about signaling and all those different things that stimulate fibroblasts to develop you know, more collagen over time. And there's been tons and tons of study in the category of retin A showing, you know, punch biopsies of skin getting thicker as, you know, after 10 years of use and all that kind of stuff. So I think, I mean, that's a 40, 50 years worth of data on that particular product.
Yeah.
So that's great, but as we talked about, it's hard for people to get on it. And then you have the next generation of stuff that's really important. I mean, you know, and there's another thing that's not talked about quite often enough is how do you get the tissues to properly hydrate, you know, between what you obviously consume, but also at the level of the actual tissue to keep the oil production at a certain level where it's optimized. And then next generation of stuff is things like you know, growth factors and peptides and different things that we all, you know, have known that added this sort of extra benefit of niacinamides and all those kind of things that can improve skin. So when I set out to set up the trifecta, this was my exact thinking. I
Yeah.
wanted to have a reduced level of retinol in there, a reduced level to the point where, and I should back up for a second. I wanted every single human being on the planet to be able to use the trifecta. Like I did not want there to be one person to say, "Oh, my skin is it's too sensitive for this," or you know, this makes me react this way or that way. That was my challenge. I wanted it to be universally used by all skin types and all skin sort of conditions. And so it went through 4 years, 4 to 5 years of kind of like testing, retesting, this and that. And I had my kind of like handful of extremely sensitive known people that they said they can never even use a single product on their skin whatsoever. Period. And so those were sort of my final test group and see if they could handle the level of retinols and the vitamin C absorption, you know, because those are things that typically give people some you know, issues. So so I wanted this to be universal. So anyway, so we started with the big picture, and then I wanted it to have all those foundational ingredients, retinol, vitamin C, you know, other types of antioxidants, and then all the other stuff that we talked about, the stuff that we know that are important. We need to proper moisture to the skin, and we need to, you know, hopefully stimulate in as many different ways as we can. And then the other thing I think is really important for people in all situations, like when you have high blood pressure, you know, down the road you're going to end up with a stroke or heart attack or something like that. So you take
Yeah.
your blood pressure medicine, but you know what? It's hard to be compliant sometimes with something that is like downstream. You don't see the benefit of it, right? But if you have a headache, you take an aspirin, the headache goes away. It's very immediate. So there's a very positive relationship with the drugs that help you with immediate changes. So I wanted the trifecta to give both immediate changes and to give long-term changes, because the long-term stuff I wanted it to work in the background to help the skin just get better and better and better over time, all the things that we talked about originally. But I
Yeah.
wanted somebody to use it within a couple weeks and all of a sudden see, yes, my skin looks more supple, looks more bright, looks more fresh, has a better glow to it, all those type of things. And so that was kind of the dual sort of challenge of it, to create something that has that. And you know, it's been very interesting for me to see the people's responses and reactions to even a short period of time. And we were talking about my longest outside of like the test groups, which by the way, we all tested them through like Visia and all that kind of stuff to see changes, Visia skin analysis. But just 3 months worth of 3 to 4 months worth of consumer use, it's been remarkable how much of exactly that they've you know, that's given them a stickiness, that immediate improvement that they see in their skin, and how simple the process is. Because what the trifecta basically is it's a combination of a step one rinse, which is a cleanser plus like some anti-inflammatory things that calm the skin, soothe the skin, decrease kind of pore inflammation, etc.
Yeah.
So that's rinse, and not a very mildly foaming cleanser. Then the second is a combination of vitamin C's and a compound, plus again more anti-inflammatories built into it. And then the Illuminate, which was the original inspiration, has like 14 different active ingredients in it. It has a mild retinol, it has more vitamin C, it has a bunch of other antioxidants, and then down the road of moisturizers, hyaluronic acid, lipid complex, niacinamide, squalene, da 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 da. 14 different actives all put together to basically give the skin what it needs in the short term, but also the long term. So my feeling was, if I could get people to do this, but do it consistently, man, we've really gotten ahead of the story, because it's kind of like the idea of you could go in and do hardcore boot camp exercises every day, but you're probably not going to be able to sustain that for too long. But if you can work out 30 to 35 minutes, 40 minutes a day for the rest of your life, you're going to be in some pretty amazing shape. And that's the idea with consistency in skincare that I thought was really important to be able to do. Make it super easy, make it short in terms of the time it takes. It takes like 2 minutes to do the entire regimen. And sometimes I'm doing it, I'm like, oh my God, I'm putting on all these ingredients in just like a minute and a half, 2 minutes worth of time.
But it's not about, see, here's the thing, and I really want to say this, like, about your approach, because I think it's genuinely brilliant. It's like, it reminds me of, the best analogy I can give anyone listening is to think about the prep stage of creating a painting, okay? Because you don't want your canvas to be all messed up and have, like, things that are just not gonna, like, the paint's not gonna go on in its true
Yeah,
form, or
that's
something's
right.
gonna,
Yeah.
right? So you
Yeah.
need those anti-inflammatory steps that you described, the cleanser and the second step. What they're doing is they're telling your immune system to be like, okay, just chill out, okay?
Yeah.
And then yeah, so it's
Yeah.
ready. Your skin's like, okay, cool, I'm good, I'm relaxed, I feel good, normal, then
Yeah.
you just put the other stuff on. It's not going to go, oh my God, what the hell is this? Because your immune system is really the part of your body that goes, oh my God, what the hell is this? So that's where anti-inflammation really comes in, is to stop those, factors in skin that are going to, like, disallow this priming of the skin, so that whatever you do put on it next, that is the richest product in your routine, it now has the highest chance of really doing and binding to receptors it's supposed to bind to, going into the skin as it's supposed to, in terms of just, like, making sure that, yeah, okay, you can formulate something that's within that, 500, kilodalton, whatever, measurement there is, but is it going to go in or not? There's a lot of
Yeah.
factors there, right? And inflammation
Absolutely.
is one of them. So
Yeah.
that's where I'm really thinking. And I wanted to tell you that I think you are absolutely brilliant, because I'm not gonna lie, early on in my, I've loved medicine my whole life. And so, I've done a lot of reading into, like, microdosing, and to keep this very pharmaceutical. I mean, why not, right?
Yep.
Like, to keep it pharmaceutical, there have been so many studies that have been done across so many different organ systems that really promote this idea of microdosing whatever pharmaceutical agent you're utilizing to completely change a pathway, or to regulate a pathway. And that is really what your skin is a lot of different pathways that are working all the time, and they need time to regulate, just like your hormones. You can't inject someone with a bunch of estrogen and then expect them to act normal. You're going to start seeing, like, psychological impacts, and, physical
Yep.
response, and all this. So,
Yeah.
what I really want to say to the listeners is that the only time in medicine that I personally, from my experience, have seen this, like, bombardment, approach when it comes to pharmaceutical or, like, chemical agents, is in the treatment of infectious diseases. Because obviously, when you have an infection, we bombard you with IV antibiotics, right?
Yeah.
We
Yeah.
bombard your system because we have to nuke it. But that can't be applied to something like skin. That's a very living, versatile, moving in so many different directions all the time. We can't use that same system. So what you're really doing here is you're allowing the skin to modulate the response in a more, like, sophisticated and optimized way, because you're giving it what it needs, but it's not being, you know what I mean? It's not being
Yeah. Oh,
rushed.
yeah. No,
Yeah,
absolutely. I
yeah.
appreciate that. You're right. Because that, I mean, the trifecta is it's AM, PM. You use the same regimen in the morning and the night. And by cutting down those dosages, the skin tolerates it better, but also, like you said, it allows it to be in perpetual sort of positive motion in that way.
Yes, absolutely. And I really love that you've kept it at 3 steps, to be honest with you, because they always talk about all those trends, right? There's always some data coming out about oh, it takes this long to form a habit, or what, all those little
Yeah.
things. But I think it's really right now more than ever, especially with all of the buzz around minimal skincare routines. And what is minimalism? This is minimalism.
Yeah. Yeah.
Science,
Yeah.
really good science. Honestly, everyone listening out there, like if you ever read a paper about somebody finding a cure for something or a new medicine or something, one trend you're always going to notice is really good science is simple. It's
Exactly.
simple.
It's so true. It's
Yeah.
so true.
It's
Everything.
the most like
Yeah.
beautiful, you know what I mean? It's the most
Yeah.
beautiful and like just elegant way of like accomplishing a goal that's happening in our
Yeah.
bodies. And
Yeah.
every single thing is doing that. So that's where I'm sitting here and I'm like, if you're someone listening and you need to know what to do with your skin and you don't know anything about it, then go to professionals like, Dr. Karam, because this is the amount of science it takes. This is the amount of studying and work and experience it takes to really understand the body and to really understand how science works. So, I'm a huge fan of your approach. That's amazing. I
Oh,
love it.
that's awesome. I really appreciate that. It means a lot to me. Yeah, no, I kind of feel like, there's been several aha moments for me, throughout my career, surgically and now this. And really at the end of the day, I feel this is the one way I can actually touch even more lives. Because I mean, surgically, I only have X number of spots per week, per month that I can do for people. And our surgical schedule gets, it's filled out for like a year and a half or so. Yeah. So but I think this is something that, it's part of the continuum of anti-aging. One really important part is obviously the skin. And for me to be able to help people navigate and find a solution that's easy and predictable and reliable, and it's not filled with BS and overpromising. It's just, again, scientifically sound and appropriate. And, I feel good about it. And I feel, I'd love to help people with this, because I know how many people have struggled with a drawer full of products that they've tried and stopped using, and the confusion that goes along with it and all the other things. So as you know, I
And
mean,
then people start mixing in things like Ayurveda and like Eastern
yeah,
herbal medicine, and
yeah,
I'm just like, oh my
yeah,
God, like,
yeah,
okay, how many articles do you want me to read to tell you about? Because
yeah,
like I'm
yeah,
gonna have to,
yeah,
So yeah,
exactly.
I agree with you. I think, here's the thing, to be fully transparent, and maybe, you can call me biased. I'm also in the medical field, but I'm not. I really believe that, science is a field that requires true curiosity in a human being to the most, like, utmost level. Because if you're not that curious, you're never going to come up with anything interesting. You're just going to be following a bunch of protocols and doing the same thing for the rest of your life. So the fact that
You
you
said
have
it.
done so
Yeah.
much and you've dedicated your life to true science is that this is very rare to see. And everyone listening, at the very least, you right now you need to go check out Karam MD Skin. uh Go to the website, check it out. It's a very easy routine, like Doc mentioned. It's just 3 steps. Look into that and look into this line before you even go anywhere else, because here's the thing: if you don't know the science, then you need to start trusting the people that do, and it's like you can't argue with, like, 11, 20 some years of experience, like learning something that's so hard to understand. So yeah, Dr. Karam, thank you so much. This has been such an immense honor hosting you.
Oh, thank you very much. My pleasure. It's an absolute pleasure. And thank you so much for inviting me. It's been a lot of fun. And you have a lot of great insights and thoughts. And it's been fun sharing and discussing them with you.
Thank you so much. And everyone listening, definitely give this episode a huge like. Leave your reviews, leave your comments if you have any questions for Dr. Karam. I'm sure I can pass them along to his team. But again, like I said, go to karammdskin .com and check out the line. And I will link everything in the concept art for this episode. Thank you, Dr. Karam, and
My
everyone. I will be back next time.
my pleasure. Thank you. Have a great day.